Hello, my name is Dr. James Shamiyeh. I'm a pulmonary and critical care physician and also Senior Vice President and Chief Operating Officer at the University of Tennessee Medical Center. This is now the 7th week that I've provided a short COVID-19 update from the hospital perspective. I should make a note that even though we're releasing this on Thursday like usual, I've recorded this on a Wednesday afternoon just because my schedule didn't allow me to record on Thursday. And so one thing I can say is that we're starting to see some improvement for the first week since I've been doing these updates in the data. So let's take a look. This shows all the hospitalizations across our region. So let me point out a few things. First of all, our region is defined by all the counties at the bottom of the slide. If you look at the purple line, that's all the patients in the hospital each day across all the counties. And it seems to have peaked and is even coming down a little bit. That's good news. If you look at the red, that's intensive care, and the blue is patients on the ventilator. While those don't appear to be still rising, they really don't appear to be dropping. And so we're going to want to watch this very closely over the next few weeks to see if this is the beginning of improvement or is this just going to essentially level off and not continue to improve? Or is it even possible that it could get worse again? At this point, we really don't know. But we'll take today the fact that the total number seems to have dropped a little bit. This is information from our hospital. So at the time of this recording, we have 124 patients in the hospital. When I last updated you a week ago, that was 164. This amount of decrease over a week is certainly not something that we expected, particularly considering that we didn't even necessarily think that we were at our peak a week ago. And so we don't yet know if it's realistic to expect that that kind of decline will continue, but certainly is favorable news. One thing I should point out is that we do not think that decline was related to mortalities or deaths. Although we've continued to have patients pass away from COVID-19, we really think this decrease in the last week is related to fewer patients being admitted to the hospital with COVID-19. I'll talk about vaccine status on the next slide, but on the lower right you see that the ages is very similar to what it has been. This gets in a little more detail about vaccination status and hospitalization. The lower left is what we showed you last week, but it is for essentially all the patients that were discharged from our facility since August the 7th. And you see the red, 78.5% had not started the vaccine series, 4.3% had started but not finished it, and 17.2% had completed it. On the lower right, this shows the mortalities or the deaths, and it breaks it down by vaccine status, again, of those who've passed away since August the 7th. And you see very similar percentages to what was on the left-hand side. The other thing we showed is the average age. And so you see the average age of those who passed away of COVID-19 in our hospital who were fully vaccinated was 79 years old, and the average age of those who had not started a vaccine series was 66 years old, a full 13 years younger. And so a few comments to wrap up. First of all, I mentioned the monoclonal antibody last week. We still have some uncertainty regarding what is going to happen with the monoclonal antibody supply. The one thing I can say is that we have received guidance about the clinical criteria about which patients should be prioritized to get monoclonal antibody in event that the supply is not enough to meet the overall demand. And so we have, and to my knowledge, the other areas in town who infuse that medication are applying those criteria, and that is to make sure the medication is given to the patients who likely will benefit from it and need it the most. The other thing I would say, just as a general comment, is that I'm very pleased that this is the first week since I've been doing this that I've been able to share with you some data that actually seems to start to be favorable and positive. And that's very exciting. But at the same time, I just want to emphasize this is not the time for us to let our guard down. If you look at a population as a group and start to see trends, that tells you what's happening across the board. And again, we're not even certain that what we're seeing is definite and is going to last, although it's certainly encouraging. But the important part of that is that the level of the individual person, they can still get very sick. That person can still be in the hospital. They can end up in intensive care on a ventilator. So it doesn't change the message about caution, and it doesn't change the message about vaccination. And because what we don't want is to see, if this is starting to get better, people at the tail end of this suffer the consequences. And so I'll close the way I always close, which is our steps to end the pandemic. We strongly encourage and advise people to be vaccinated. If you have the slightest bit of symptoms that could be COVID-19, we want you to be tested. We know that wearing a mask can provide some immediate protection from COVID-19, and certainly all the other steps that we emphasize every week. So again, thank you for your time, and I expect to be with you again next week to look at more data, hopefully data that has trended in the right direction, but whatever it is, that's what we'll show. Thank you very much.